Premature birth is a global health problem, and statistics show that the premature birth rate is 14 out of 1,000 live births, and prematurity is one of the topmost causes of neonatal death. At Nakasero Hospital, we join the world to celebrate and commemorate the World Premature Day. And we are going to showcase activities, some of the activities that take place in our NICU to try and reduce the death rate of prematures. By definition, a premature is any baby who is born before 37 complete weeks. And these babies who are born prematurely usually have concerns which are supposed to be addressed. And generally, every newborn has 4 needs. Number 1 is breathing. Number 2 is temperature regulation and control. Number 3 is feeding. And number 4 is infection control and management. As Nakasero Hospital NICU, we have put protocols across that try to address all those 4 needs to improve the lives of our preterm newborns, therefore reducing the death rate in the whole world. As we enter our NICU, we have a protocol that we have put across for every person coming in. So as a client enters in, they put on our shoes. We have special shoes. They wash their hands, and the main reason for hand washing is to prevent infections to these newborns. We put on our gowns. Our gowns are green in color. Then we put on our cape. We have a theater cape for our hair. We put on a mask, and then we lead you to where the baby is. So we have different equipments that we use on our babies. So specifically, we're looking at prematures. And the first equipment we are going to talk about is an incubator.
This is an incubator. It is used to keep babies warm. Normally, prematures have an issue of temperature regulation. So we normally put them in the incubator to help them to self-regulate their body temperature. It's an automated machine. We normally set in the normal temperatures of the baby, so it self-regulates itself to keep the baby warm. It has other accessories like weighing of the baby, so it prevents us from removing the baby, disconnecting the baby from machines to take the baby to the weighing scale. So we normally weigh the baby from the incubator, but its major role is to keep the baby warm.
The second equipment is an infusion pump. An infusion pump is used to give intravenous fluids to a baby to meet the metabolic demands and nutritional needs. It has advantages. It is automated, so it respects the instructions given to it. It reduces the workload of the nurses. It reduces the risks or the incidences of medication errors. So that is why we use them, because our babies are precious. The other equipment is a syringe pump. It is close to an infusion pump, but the difference is for it is used to give smaller volumes of the drug, but the advantages are the same. The other equipment is a monitor.
This is our patient monitor that we use in our NICU to monitor our babies, the vital signs. Vital signs, I mean, we monitor the SpO2, the heart rate, the blood pressure of the babies, and the temperature. Our monitor is very helpful in the NICU because it helps in the continuous monitoring of our babies, and it also stores information in that you can come after either an hour, 2 hours, a day, 3 days, and you're able to retrieve information that was stored in the monitor concerning the baby's vital signs.
The other equipment is a phototherapy machine. Premature babies usually get a condition we call jaundice, And this jaundice is usually treated with phototherapy, which therapy comes from this machine. So this machine is called a phototherapy machine. So we switch it on, and that blue light is the one that treats the jaundice. And how it does it in a way that it converts the jaundice that the baby cannot excrete normally. It converts it to a form that is dissolved in water, so that jaundice comes out through the urine and the stool.
As mentioned earlier, one of the needs of the prematures is feeding, and I would like to show you our storage for the breast milk. So we have our fridge here on the unit. This side we have the frozen milk. We defrost it when we are going to feed our babies, and we keep it this side of the fridge. So we feed our babies on exclusive breast milk despite them being small.
The other special thing that we are going to emphasize is the Kangaroo mother care.
Kangaroo mother care is among the most cost-effective intervention, which helps in reduction of morbidity and mortality in neonates, especially the preterm babies, those who are below 2.5 kgs. And among the benefits of KMCs, we have it helps in weight gain. It helps those preterm to initiate breathing. It helps to control temperature. It helps the mother in early initiation of breastfeeding and milk production. It allays anxiety when the mother does kangaroo. It helps the mother to build confidence. It helps in bonding. We are going to demonstrate how KMC is done. Here we have a mother and her baby. It should be done, you leave the pamper on. The only thing is the pamper and the cape. The mother has to be naked. The mother's skin, no bra, nothing on her skin. And the baby should be in a pamper and a cape only. You put her on the skin directly between her breasts. You cover well. The baby, you leave the cape on. So this is a sheet, and you can always add on a duvet, something warmer. It should be done continuously and not interrupted.
As we celebrate the World Prematurity Day, our theme is small actions, big impact, immediate skin-to-skin care for every baby, everywhere. Our message as Nakasero NICU nurses is to encourage the community to embrace the skin-to-skin care, because we have learned that is one of the measures that can help to improve the lives of our prematures by keeping them warm, helping them digest milk, put on weight as expected, and bond with their mothers. So as a community, we should embrace it, do it, so that it grows from being a small action to a big action that is recognized by everyone.